Good morning, everybody. Look, I just want to start by acknowledging that I'm here with obviously the Treasurer to just take us through some more updates in regard to relaxation of some of the restrictions that have previously applied, but I also just want to start, before we do that, by just advising on the latest numbers. And look, New South Wales continues to do extremely well. 2 new cases overnight of locally transmitted COVID-19, so up to 8 p.m. last night. 8 cases, though, of quarantine international travels. I think that does indicate the level of challenge we have at the moment of people who are coming in from overseas and the proportion of people who are actually having positive outcomes, and re-emphasises yet again just how important our decision around our structure, our hotel quarantine system was and is and will be going forward. Also want to say this, that yesterday we had only 7,401 tests, but to 8 p.m. last night people have heard the message and came forward, so that we had 14,932 tests last night, but still not good enough. For us to be continuing to open up our state, our community needs to be with us on this journey in a very serious way. We need to have people go out and get tested with the slightest, even the smallest possible symptoms of a cold or flu. So scratchy throats, a bit of a cough, a runny nose, temperature, go and get tested. Please get tested. We cannot continue to do the opening up of our state unless we have very, very clear understanding of how much of this virus is circulating in the community. We know it's out there. We've had it happen too frequently to say that it's not there. Just recently we've had it, so please go and get tested. Can I also say that both of today's locally acquired cases are close contacts. One's a man in his 50s and one's a woman in her 50s. They're close contacts of a confirmed case linked to a person who attended the Great Beginnings childcare centre at Oran Park. Now, that obviously continues to concern us. There are now 22 cases linked with the Oran Park community cluster. So if you are in Oran Park, or if you are around Oran Park, if you're in any of the suburbs near Oran Park and you have any symptoms at all, please go and get tested. I also just want to note that the Health Department today, or Health Ministry, has also just highlighted this, that a confirmed case of COVID-19 linked to that Oran Park cluster visited the Bavarian Macarthur in Macarthur Square at 200 Gilchrist Drive, Campbelltown, on Saturday the 10th of October from 7 p.m. to 9 p.m. So if you were in that Bavarian Macarthur on Saturday the 10th, then you would be considered, if you were there for more than an hour, you would be considered a close contact, and you should get tested immediately, and you should isolate for 14 days. And no ducking out under 14 days, it's got to be the full 14 days. Anyone who dined outside the Bavarian Macarthur, you'd be considered a close contact, and certainly you should also get tested, but if you have any symptoms whatsoever, but also keep an eye out for the next 14 days or the 14 days after that date to see if you do have any symptoms. I also just want to point out in regard to the testing that in terms of the clusters, we've had, as I said, 22 cases now from the Oran Park cluster. We've had 16 cases from the Lakemba GP cluster, and the private clinic cluster that was at Liverpool, there are now 12 cases associated with that. So the good news is the cases we're getting are off the known clusters, and that's very good, but it still keeps us on high alert, because when we're still getting locally transmitted cases, particularly when the numbers are not that high that have been tested, the entire government and certainly the public health teams are on high alert. So again, just stressing, we need to have you tested, go and get tested. What I'm hearing from some people is they feel guilty because they think it might be hay fever or asthma and they don't want to waste our time. Can I say you're not wasting our time, you're doing the best for yourself and for your community. Go and get tested. You are on the front line of this war against COVID, we all are, and we need you to be supportive. Now, as a result, though, of our continuing low numbers of cases, we have actually, the government has made some more decisions which are going to make a big difference, I think, for the community, both in terms of the economy, but also in other ways.